So again, I want to make sure we, we stay on time tonight. I know people will be continuing to log on, over the next few minutes. But again, I just wanted to thank everyone for taking some time this evening just to hear, what's been going on at the College of Pharmacy and, of course, the Health Sciences Center, the state, the University of New Mexico. We've all been in a, in very strange place over the last. It's been 9 weeks since the university went into limited operations. Can't believe it's been that long. But again, I just want to again thank Dr. Paula Roth, Chancellor for the Health Sciences Center, and again, who's been doing just an awesome job about leading, leading this Health Sciences Center and the university and the state as well through this crisis. We still got a ways to go, and but again, I wanted to give him an opportunity to talk about what's been going on at the state level and at the Health Sciences Center. So, Paul, if you want to share your screen, and we can go from there.
Great. Well, thank you very much, Don, and I really appreciate having a chance to brief all of you about what we're doing here at the Health Sciences Center. This has been a very, very difficult time for everyone. And of course, in New Mexico, we have all of our unique elements, not just our populations, but our geography and our culture and a number of other elements, which we are very, very proud of, but at the same time, create some challenges, particularly in these kinds of situations. So I will attempt to pull up. Aha. Can everybody see that?
It worked, Paul.
Oh my goodness. Okay.
I know. I'm usually shocked too when it works for me.
Yes. Okay. Well, so I asked the staff to put together just a general overview of all of the different types of activities out of the Health Sciences Center. And I did want to point out, as I'm doing this, some of the really wonderful things that Dean Godwin and the faculty and staff out of the College of Pharmacy are doing as I'm going through this. All right, if I can go through it. Let's see, it's not advancing. Okay, there we go. Okay, so we kind of lumped these types of activities into a couple of categories. The first one is ways in which we're trying to support our faculty and staff. While everyone at the university, I think, knows that how we've been trying to categorize our staff, we were able to tier our staff based on the degree of the kinds of functions that they all have. So tier 1 employees are those who really have to be on campus in order to carry out their mission. Tier 2 staff are those who are still very essential but could carry out their activities from home. And tier 3 staff are those who really should be staying at home and not being on campus, and on occasion essentially be on call for certain activities for the university. And so in order to prepare for all of our remote operations, we've had to issue over 1,000 new Zoom licenses. We've had to expand our online platforms. We have a number of different, in addition to Zoom, a number of other technical venues for our teaching, research, and a lot of our clinical visits are now either by telephone or a televideo activity. And what we realized very early on was that for those tier 1 employees who really need to be on campus, this all happened at the same time that the schools closed, and many of the childcare centers were also closed. So we had to come up pretty quickly with a means to help support the staff and faculty who have children, young children, to provide some childcare placement for them. Okay, in student support, this has been a new experience, not just for our faculty, but for the students as well. And particularly among many of the programs at the Health Sciences Center, we had to pull all of our students out of the clinical venue when the number of COVID positive patients began arriving. This was a national recommendation from a number of our professional associations. And so we've really had to come up with alternative experiences for them. We're fast approaching a time though where based on the curriculum and the accreditation standards that we will have to begin reintroducing our students back to the clinical venue, but we'll be able to draw on a lot of those remote sessions and encounters using either telephone or televideo kinds of experiences. We early on recognized the need to help support not just individuals within the university, but around the state through volunteers. And at the current time, we've created a clearinghouse, and we have over 400 students and faculty volunteers for a variety of activities that I'll go into in a little bit. In the medical school, they actually converted one of the courses into an elective block for COVID-19. It became a large public health course where they were able to identify different ways to do effective communication to the community and support other aspects of the clinical enterprise. And particularly out of the College of Pharmacy, there were a number of students who are working with the Poison Control Center in answering COVID-related questions that are coming through on that telephone line. In patient care, you can just imagine the kinds of adaptation we have had to make in managing what we felt was going to be a huge number of patients coming into the hospital. And so just to give you a general idea, UNM Hospital usually runs in excess of 100% capacity. And you may ask, how could we possibly be running greater than 100%? Well, we ordinarily board patients in the emergency room waiting for beds to open up. And so if you count all those patients, sometimes there'll be up to 20 or 30 patients waiting in the emergency department for beds. And so we had to quickly, almost overnight, and it took about 2 weeks actually, to create a capacity, inpatient capacity in preparation for what we anticipated to be a large number of admissions from this pandemic. And so one way that we did that was, and what was recommended nationally and by the governor, was to reduce the number of elective cases. And as you may know, we categorize surgical procedures as elective, which doesn't really mean that they're optional. It just means that we can schedule them, and they're elective as opposed to emergent procedures. At the current time, as of this morning, we've had to delay over 1,400 surgical procedures, and that doesn't count all of the radiological procedures, interventional radiology, mammography, and a number of other types of radiological procedures, cardiac catheters, a number of different types of procedures. We did this through a set of guidelines out of the American College of Surgeons, and that organization identified 4 tiers of elective surgeries. And the tier that we implemented was tier 1, which are those patients who could wait 3 months or longer for their procedure. And so we canceled those surgeries right away. Every month, there are more and more of them. But given the current rate of growth of cases in New Mexico, we're developing some recovery plans that will begin reinstituting those elective surgeries within a week or two. Also, as it turns out, most of the admissions are in our critical care unit. And at the current, based on the number of beds that we have in our critical care units, we're at 110% today of licensed critical care admissions. And the only way we were able to manage that was to convert a number of other units and converted them into adult critical care beds. One example is in our Barbara and Bill Richardson Pavilion, which is essentially the children's hospital. We converted the operating rooms there and the recovery room into critical care beds. And that automatically allowed us to increase our ICU capacity. And as you see on this slide, from 72 beds ordinarily, we were able to actually more than double the number of critical care beds. We also have taken steps to convert other units of the hospital, one of which is the Clinical Neurosciences Center, which is an ambulatory unit out of UNM Hospital, and temporarily have created about 64 additional beds for more routine kinds of admissions, a lower acuity. Unfortunately, as it turns out, the vast majority of our admissions are in the intensive care unit, with the vast majority of them having to be on a ventilator. And at this point, I think our mortality rates associated with patients on a ventilator is somewhere a little greater than 80% mortality, unfortunately. And for those patients who have recovered, and there have been many, and have left the hospital, we had to create a dedicated outpatient area for post-admissions, post-discharge follow-ups for those patients. And just a couple of comments about how we're managing visitors in the hospital. And this is always a challenge in an effort to protect the rest of the hospital staff, the patients, as well as visitors. We've had to limit who comes into the hospital. And that can become a significant hardship for the families of loved ones who had to be admitted. And so we've purchased a number of iPads, and at least fortunately for the majority of our patients who want to remain in contact with their families, they are able to do that through the internet and using their iPads and FaceTime and so on. You may have read nationally that there are many hospitals in the United States that have prevented family members to even be in the room at the time of the passing of their loved ones. And that has been very traumatic for the families of individuals who have passed away due to COVID. We decided not to do that. And in fact, what we do allow is up to 2 or 3 family members to be in the room at the time that the patient is about to pass away. And it has really made a huge difference. And just as an FYI, we have not had any transmission of the virus to family members, since they are all in PPE. We've been taking a greater role since the Health Sciences Center is the state's only public and academic health sciences center in the state. We see as part of our mission to provide care for all of New Mexicans. And we've been very instrumental in developing new testing capabilities. Some of you may know we are a 50% owner of TriCor, along with Presbyterian, and TriCor is one of the largest labs in the state of New Mexico, and they've been increasing their testing capabilities almost on a weekly basis now. We were very concerned about the status of the homeless in Albuquerque, and working with the city, we were able to provide some volunteer services and reassignment of some faculty to a West Side shelter that houses a large number of the homeless population. And they've just done a miraculous job there. And just to give you a little sense, in other cities where they have tried to control the spread of the virus among the homeless population, cities like Boston, New York, LA, the average percent of individuals who are homeless with COVID in those shelters averages between 17 and 25% of the population. And obviously that creates a huge problem with quarantine and being able to manage those patients. Our percent positive homeless in the West Side shelter is 0. And that's all due to the medical director, Dr. Parajon, who has been very early on reassigned to that location and has set it up so that it conforms with all of the social distancing and other measures to assure reduced transmission of the virus. We have done a number of other activities. Our Office of the Medical Investigator is a part of the public health system in New Mexico, and it tracks the numbers of patients or those who have passed away in their autopsies and reports all of those up to the state. And in addition, we have a number of statewide activities. The governor early on created the medical advisory team. And this is a group led by our Senior Vice Chancellor for Clinical Affairs, Dr. Mike Richards. And it follows the kind of structure that was recommended by the Institute of Medicine right after the H1N1 pandemic about 10, 11 years ago. And in that document, they set up or they created a set of guidelines to be implemented in extreme circumstances, and that is, those are considered the crisis standards of care, and part of a state response to a level of pandemic such as the one we're in now is to create this medical advisory team, which is a multidisciplinary group where all of the health systems within the state participate. We've added Dr. Laura Banks and Dr. Christy Beato and Christoph Lambert to that group, which does, and they all have provided a really important input into setting policy and helping the governor set certain public health requirements. And working with David Scrace, the Secretary for Human Services, and Secretary Kunkel out of the Department of Health. Rob Schwartz is one of our regents. He's a retired law professor here at UNM, and his career was in the area of bioethics. And part of what the crisis standards of care requires is when we have to implement, it's essentially talks about a situation in which it's a true disaster, where we know that the demand for critical medical services lag behind the huge demand that is required. So our capability of meeting that demand is simply not there. And in those situations, often we have to provide, rather than standard of practice, we have to provide palliative care. And so you know, the scenario is, if we have 100 patients all coming into the hospital and they all require ventilators, but we only have 10 ventilators, how do we make certain decisions about who actually has access to those types of services? And in the crisis standards of care, it's driven by ethical standards and principles of care. And Rob Schwartz leads that group in the state of New Mexico in setting those ethical standards. Fortunately, we will not have to get into that level of standard of care in New Mexico, although they were on the brink of that in New York and in Washington State. But it clearly is not going to be happening here. The university has actually provided over 40 representatives that we are lending to the state in a number of work groups and other task forces set up by the governor. The governor also asked me to help with Secretary Trujillo, the Secretary for Indian Affairs, to help develop plans to respond to the huge outbreak of the pandemic among the Navajo Nation. And we're actively working with the Department of Homeland, the National Department of Homeland Security, IHS, and the state of New Mexico, state of Utah, and Arizona in trying, and closely with the government of the Navajo to create a reasonable response to their overwhelming situation in the Northwest New Mexico. Dr. Kaufman and Dr. Tassie Parker have been leading a group to coordinate other outreach efforts for our Native communities in New Mexico. We're working closely with the chair of the All Pueblo Council of Governors and funneling their requests for support to Dr. Kaufman. Out of the Prevention Research Center, that's a center out of the Department of Pediatrics, and they have been arranging for other kinds of support services to tribal areas. We have, as you can see, a number of other activities, but the College of Pharmacy is also reaching out to various tribes and pueblos and helping with personal protective equipment, supplies, and other hygiene supplies for those areas. I mentioned before the HSC volunteers. We have 84 faculty, 301 students. The College of Pharmacy has contributed, or we have had 8 volunteer students and 4 staff. And currently there are 37 pharmacy students who work out of the Poison Control Center. In the area of research, there are 4 very important projects out of the College of Pharmacy. Graham Timmons is working with Voyo Duretic and Stephen Bradfute, I believe I hope I'm not killing that last name. And they're working on looking at various drugs that could be used in COVID-19. And of course, one of the real stars out of the College of Pharmacy, Dr. Campen, has 3 projects that he is working on that we are hoping will result in some real impact on the way in which we're diagnosing and treating this virus. And obviously, one of the things that Dean Godwin is going to be talking more about will be the Diamond campaign for the college. And I just want to point out that the college and Dean Godwin had an incredible first ever virtual graduation. It was remarkable. There's a video about it, and I'm hoping that he has had a chance to send that out to all of you. And I think you'll all agree with me how wonderful that event has been. And so with that, I will stop sharing and be happy to respond to any questions.
Thank you, Paul. So if anybody has any questions for Chancellor Roth, if you just want to unmute yourself and just ask your question.
I have a question. So I work at PharMerica. I'm a long-term care pharmacist, and we were just gifted a ton of individual packages of hand sanitizer. So my director was hoping to get it to the Navajo Nations where they need it the most. And since you are leading, I was wondering if there might be any good contacts of how we could get that hand sanitizer to those people.
Yeah, so if you could send me an email and I'll connect you with the right people.
Perfect.
I'll connect you with Secretary Trujillo, and we have on our rapid response team members of the Navajo Nation, and there's a logistics task force, and we can put you in direct contact with them and make all the arrangements. So my email address is proth@salud.unm.edu.
Perfect. I'll send that tonight. Thank you.
Great.
And yeah, well, you know, it was her idea and I compounded, I don't know how much hand sanitizer. So in terms of the pharmacy, you know, we have a never ending supply of the compounded stuff. But my next question, I'm not sure if you're the best person to answer this, but I know at some point I filled out some, you know, registration form for volunteering at the Poison Center as a COVID, you know, triage process. Are you guys still needing volunteers for that?
I think Dean Godwin would. There you go.
Okay.
Okay.
Cool. Well,
Rebecca,
I'll be posted. I'll keep myself posted.
You know, email me too. I mean, like, I don't know exactly which, you know, where you filled this out, but I can get your name over to.
I know when it first happened, there was like this form and that form, and
yeah.
You know.
Well, I know that Dr. Smolinski is looking for volunteers, particularly now. We're sort of in that we're in a downtime between, you know, our class of 2020 students are done, and we haven't started rotations for the class of 2021 yet. So. She is in need of volunteers, so just send me an email too, and we'll.
You got it.
And I'll get your name over there.
All right, thanks, guys.
Well, if there's no other questions for Dr. Roth, I appreciate you taking the time this evening to spend with us, and you know, feel free to stay on. But I'm sure that you have other. I know you have other things to do. I'm sure you have to get ready for some Zoom meetings for tomorrow.
I know.
But thank you very much, Paul.
Well, thank you, and everybody stay safe and stay healthy.
All right, so I'm here. I'm trying to get all my screens here together. figure out what's going on. All right. So again, obviously, we've been doing a lot, for the state, for the city, for the city of Albuquerque. Let me tell you a little bit more, just some more of the details about, what's been going on at the college. First of all, that Paul Roth did mention that we did have our online convocation last Friday. Hopefully, some of you had a chance to watch it. It actually couldn't have been better. It was it was better than I thought it was going to be, and I thought it was going to be pretty good. I know that we are also putting together, I know Jose is putting together, I guess what I would call a highlight reel, because the whole thing is about 2 hours long. So we're putting together a highlight reel that we're post to our social media and send out, just so you guys can catch the highlights. But again, if you did get a chance to see it, having the parents and the siblings and the husbands, and there were a couple dogs in there that were helping do the hooding. It was pretty spectacular. And I know it wasn't the same as an in-person ceremony, but I really do think it was pretty spectacular. We've been getting a lot of kudos from around the HSC and around the university as well. So again, I want to thank all my staff, Jose, Crystal, Rose, Markella, who helped us all put this together. It was definitely a team effort for sure. But again, so that was our class of 2020. And when all students were pulled out of the clinical environment in the hospitals and the ambulatory care centers, we had to pivot quickly. And I am so impressed with my Office of Experiential Education, so Tracy White and her staff and my faculty, and some of you guys are the preceptors who were precepting even when the students were pulled out. We were able to design very quickly the rotations that allowed our students to finish. And again, I think the class of 2020 was also very grateful because now, they've had their convocation and they will officially graduate on Saturday. So now they can go out and do their, and take their NAPLEX, take their board exams. Again, you guys probably know that, the entire University of New Mexico went to online lectures. That included me. I had never done an online lecture in my entire life. And within 1 week, I had to deliver an entire pharmacokinetics course online. And our last lecture was yesterday. Our last exam is tomorrow. I think the students were okay. What I've really seen from the students, first of all, the students have been amazing as well, being able to adjust, to the changes. And I think actually the delivery of the material went fine. I think the students definitely got the material. That was fine. But really, it's that small group learning, it's the labs, and it's just the camaraderie of the students. That's what they truly miss. That's what we've heard. And, hopefully we'll be able to get that back together, at least to some extent in the spring. Let's see what else we got here. We talked a little bit about the research. So Dr. Roth talked a little bit about the research. We've in addition to COVID-19 research, we've also been continuing on. We're still putting out, our grant applications. We're still getting grants in. Papers are being published. What I've heard is the faculty are saying because they are spending so much time at home and, when they're not, doing their lectures, they've actually had time to write those papers that they've been just kind of pushing off for, an extended period of time. So now they're actually able to get those papers written. So I think we're actually going to have some increased productivity, from our research mission, which is spectacular. So hopefully those publications will lead to more grants. And, more grants will lead to more money for the College of Pharmacy. Always a good thing. I have to be I'm almost like an economist and a commodity trader. I've never paid so close attention to oil prices in my entire life. But we'll talk about that later when we get to more of the budgetary pieces. Let's see, what else we got here? Again, the patient care, my faculty continue to just provide, incredible patient care. Again, a lot of it is through telehealth now, but plus what Dr. Smolinski's done, what Susan Smolinski's done with the Poison Center, it's actually a separate. It's not the Poison Center line. It's actually a separate phone number, and it's actually called the All Hazards line. And the All Hazards line is always there, and it can be activated in times of pandemic. So the last time it was activated was in, I think, 2009 with the H1N1 pandemic. So it had been 10, 11 years since we had activated that line. Susan wasn't even here the last time it was activated, but we got that thing up and running literally in 3 or 4 days. And then she did an amazing job about, getting students trained up. And, also in addition to students, we also have had a rather large number of faculty and some staff who have also volunteered their time to handle that COVID hotline. And in the beginning, they were getting like close to 1,000 calls a day. It's actually gone down, but they're still getting 300 to 400 calls a day. And then it seems like every time the governor has a press conference, that number spikes. Like that next day, the number of phone calls spikes. But she's done an amazing job getting that together. Renee Mercier, a lot of you know Dr. Mercier. She's working on the HSC COVID task force, working on the prophylaxis trial and convalescent plasma trials. So she is doing a lot of work, really at the state level, with her infectious disease expertise. Unfortunately, still with the patient care, Dr. Roth mentioned how all these diagnostic procedures, cardiac cath labs, everything that they've been, reduced not only at UNMH, but across the state. And basically our translational radio pharmacy business has dropped almost to zero, just because there's nobody that's having procedures. It is starting to come back. We are actually starting to get some orders for some radio tracers and whatnot, but we're still a long way away. So we'll have to just, we're still doing some of the therapeutic doses for cancer, some of our theranostics. But overall that business is down, but hopefully as procedures start to occur again, the elective surgeries, that'll come back. My hope is that it'll come back with gusto, and we'll have to work extra hours to fulfill all the orders, but we'll have to see. I'll keep you guys posted on that. So let's talk about the future. So that's sort of where we are right now. The students, we're finishing up the semester. Our P1, P2, and P3 students, they're all going to move on to the next year. Our class of 2021 that are going to be starting APPEs, they're a little nervous. I'm a little nervous for them. I'm in constant contact with Tracy Hunter, and who's Associate Dean for Experiential Education. And by happenstance, we changed our APPE schedule, which used to start in June, but we've changed it to start in July. And of course, we had no idea that a pandemic was coming and students would be removed from the clinical environment. But that gives us an entire extra month to play with, to be able to, before rotation starts. So, I am literally crossing my fingers, saying a little prayer every day that this, we have our students back in the clinical, in the hospitals, not only UNMH, but Press, Lovelace, all the hospitals, Memorial Medical Center, that we get them back, by the end of June. If not, we will always improvise and overcome. We will have our students graduate, for the class of 2021, but they're nervous, they're worried because they don't know exactly what's going on. We're in constant contact with the students, telling them, we don't really know either, but we're here for you. And, you can always reach out, and, and the second we know something, you will know it, probably within the hour. So again, we're working that way. We're in constant contact with our incoming class of 2024. I can't believe I'm saying that we are actually admitting a class of 2024. But that class, remember, if you guys remember, admissions is it's a hard time for admissions in pharmacy school. all around the country right now. So that class is going to be small. It's probably going to be somewhere in the mid 50s. But right now, everybody that has put their deposit in, nobody's pulling out. So hopefully we will continue through the summer and be able to admit that next class, into the College of Pharmacy. So I think right now we're in a pretty good spot with our students. I think we're in a really good spot with our research and the clinical aspects as well. But let's talk about a little bit more about the future. Let me bring up another. So right now, we're working as a university, of course, to be able to start bringing people back into the office. So since March 17th, we've been on limited operations. So Dr. Roth did mention that tier 1, tier 2 employees, again, tier 1 being, people who have to be at the College of Pharmacy. So all our poison center, our poison information specialists, our radio pharmacists, some of our research technicians. So we did have a couple of dozen tier 1 employees. The vast majority of our employees are tier 2, which means our jobs are important, but can be done from home. I am tier 2, so I guess my job's important, but I've been working from home. Again, since March 17th, I think I've gone to my office like 3 or 4 different times over this time. So my dogs are kind of wondering what I'm doing home all the time. My wife is probably getting a little bit tired of being home all the time, and I'm telling her, like, turn the light down. I got a Zoom meeting. But I think it's all working out. But again, we're starting to come back. So the higher education department is working with all universities and colleges across the state to figure out the best way to bring people back. So it's called basically a reopening of campuses plan. Now, we were supposed to start coming back in what we're calling phase 1 of coming back on May 18th. That has actually been pushed back to June 1st now. That information came out yesterday, so it's kind of hot off the presses. So we're going to kind of stay status quo for another couple of weeks. That's for a number of different reasons. Number one, the virus transmission rate hasn't come down quite as much as we wanted it to. And second of all, it really gives us time to really prepare the facilities, not only the College of Pharmacy and all our other buildings, but the Health Sciences Center and the university as well. We're going to be, so the Health Sciences Center has ordered 15,000 cloth masks. So every faculty, staff, and student is going to be getting probably 1, if not 2, cloth masks that we're going to be required to wear, whenever we're in common areas or walking through the hallways. So it's going to be we're going to be a bunch of masked people when we come back. We're also there's going to be some plexiglass barricades going up. Like I would say, like for instance, for those of you of our reception desk at the college. There's probably going to be some plexiglass that's going to be put up. So when people come in to visit the college, there'll be a barrier between our receptionist Ramona and our visitors. We've also bought masks for our visitors. So if someone comes in to the college and they don't have a mask, we will ask them to wear one. We will give them a mask as well. We've also ordered gallons of 95% ethanol. Not to drink, although every once in a while a little sip wouldn't be a bad idea. But we're going to dilute them down. We're going to have disinfecting sprays everywhere around the college because we will be disinfecting our surfaces all the time. I'm serving on a committee right now that is actually putting all these things into place. Again, between the plexiglass and the masks and the disinfecting and the social distancing, and putting together those plans to really try to maximize the safety. So when people do start returning, we can return with at least trying to stay safe. Let's see what else. Oh, still okay, yeah. So let's talk about what I think. So This is just from what I've been hearing, what I've been reading, and sort of my my thoughts on what it's going to look like when we come back in the fall. So, our fall semester starts the second week of August. So obviously that'll still be summer, but that's our fall semester. And what I anticipate, and I really hope this is the way it happens, is our large lectures. So I think anything over 50 students, that's not only be for the College of Pharmacy, but also for the university. If a class is more than 50 students, that information will be delivered online. But if you have classes smaller than 50 students, I think those courses will be able to meet in person, but of course with proper social distancing. So, we'll be able to have our laboratory courses, our aspects of patient care labs, they'll be able to meet in person. Our professional electives, we'll be able to meet in person. And I'm really hoping to have that small group active learning, in our didactic courses. So the students can work cases together, can do calculations, can really solve problems together. And again, this will be in separate rooms. There will be some online delivery. So what I sort of imagine is, we may have groups of 8 to 10 students in a small conference room, and there might be 5, 6, 7, 8 groups of that size in a class, and then the professor, the lecturer will be in their office, but we'll be able to zoom around. So right now, when we're doing this, everybody's in their own house, but maybe we can at least bring some students together. We've sent a survey out to our current students, basically asking them some questions about how the online delivery of both the content and also we were taking, all the students were taking their exams at home. So we were also looking at how the assessment went. So we're going to get some feedback from the students. We're having the faculty who were teaching online meet next week. So we're going to get some faculty faculty feedback as well. And we're going to work hard over the summer, to really, I think we did a darn good job considering we had a week to pivot from, from a regular education to online delivery. But we want to make it better for the fall, because it's obvious that at least our large classes will be delivered online, at least for the fall, and hopefully not past that. But it's kind of we're in an unknown situation. So what I'm telling the students is, when they return to the college, things are going to look and feel different. If you guys come to the college, it's going to look and feel different. It's going to be weird to have plexiglass up at the reception desk. It's going to be weird, if you're in the student lounge and there's only half the seats, and half the tables in the student lounge, because we have to lower that density of people in those rooms. But even though it's gonna feel different and it's gonna look different, it's still the College of Pharmacy, and we'll be back together. And that is the most important thing I think we can do, is to really continue to build that community, and again, just bring us back together. This has been hard. I was texting back and forth with Markella today. She sent me an email, and I sent back an email that I said it might have been a little snippy. So I sent her a text and I said, I'm sorry for being snippy. I think this is starting to get to me a little bit. So like Jennifer just said, it is a different world. But I think we're all going to adjust. Hopefully we'll come out stronger on the other side. We're definitely going to come out different. But I think this College of Pharmacy will come out strong. I think we have strong leadership, whether it's the research mission, the patient care mission, the education mission. I've got great people who work for me, and I appreciate them every day. And I just want to get us all back together again. And I want to have our events, and I want to have our tailgates, and I want to have our weekends back. I can't even tell when it's Saturday anymore, because it's just another day. But again, so I think we're trying to we're delivering an excellent education to the college. Things happening at the state level. Communication is going back and forth. This is the reason I'm having this this town hall. And again, I appreciate you guys coming, taking time and zooming in. So another Zoom meeting. But if anyone has any questions, comments, again, feel free to unmute yourself and chime in. I'd love to hear from my alumni.
Hello, Dean Godwin. This is Monique. I do have one question for you. How have the students been through all of this? I mean, granted, I know that they've been volunteering a lot. We've heard from a few students about their tests, how that has changed, but how has emotionally been their response? And in a situation like this, how can alumni step forward and help?
So, I mean, again, I think they're understanding. I think that they understand why we're doing what we're doing. They have been great. I mean, we had something called a Be Well Bingo that the students put together. So you could do things like volunteering, going to the Roadrunner to help. And we had students, when they completed their bingo card, they got prizes. I went out because I said, I'll buy some gift cards. What do the students want? What kind of gift cards? And actually, it was interesting. The students actually said, we wouldn't mind, grocery gift cards. So I went out and I bought a bunch of Smith's grocery store gift cards. So there you go, Vanjie. So that's what they want. Like I said, I think that intellectually and educationally, I think they're okay. But it is, they miss that camaraderie. They miss their study groups. They miss the small, they miss just hanging out with each other. I mean, these classes are tight and, they haven't seen each other. To tell you the truth, they've done pretty well, social distancing themselves, because I thought they were going to be like, having their little study groups, but it hasn't happened. So again, I think it's incredibly important. And this is what, I am advocating for. Whenever I sit at these, at these meetings and with these groups, with either at the university or the HSC level, that we've got to get, we have to get the students back on campus. We have to get the students, back, face to face with each other, with the faculty. They need the support. But again, we've got to do it safely. We've got to make sure that. That I mean, obviously nothing's going to be 100%, but we really need to make sure that we do it as safely as possible. And that's my biggest thing. I want to see those kids again. It was so weird. I've been teaching for 24 years. This is the first time that, I've not had to teach a class face to face. And, for the first week or so, it sucked. I want to tell you. It was terrible. I mean, it was just, the students were really good about asking questions through chat or unmuting themselves and asking questions, but it just was not the same. I couldn't get their, were there quizzical looks? Do they understand what I'm talking about? Kind of hard to tell. So again, I think intellectually and educationally, I think they're fine. Emotionally, I mean, they're a little on edge. So, and we've also had students, that, when we went online, they've left town. If they don't live in Albuquerque, they've left. We have several of our students who are, out in the Navajo Nation. And, we had one student who didn't have any internet access at their home. And they had to go into Gallup. So every day they drive into Gallup, I'm not sure exactly where they went. They would get their internet access. They would do their online courses, download notes, but then Gallup got locked down for 10 days. And the student couldn't go to Gallup and didn't have any internet access. So, again, this is not me as dean, but this is just me as a faculty member. Like I said, the student, they were finally able to get back into town, but they're like that final exam is tomorrow, but they're not ready for it. So I said, look, when do you think you're going to be ready to take it? So the student's going to take it late Thursday. But, and I think, and a lot of the faculty have been like this. We've been very, very flexible with the students. because some are taking on, again, some of our students are taking care of their kids. They're homeschooling their children while they're trying to school themselves as well. So Jen Ortega came in with a question: has the COP given thought to what the future of pharmacy could look like in post-COVID world? Yeah, we're really starting to think about what that's going to look like and what those opportunities are for pharmacists. Obviously, hopefully we'll have a vaccine and people will be lining up at pharmacies all over the country to get that vaccine. Jennifer, I expect to be first in line and get a little head start for my vaccine. But but again, I think, our pharmacists going to be more involved in public health. Can they be more involved in contact tracing or testing, point of care testing? I think this does offer a number of advantages. We're just going to have to see where this stuff leads. And I think once the semester ends, this week, we can all maybe take a little bit of a breath and start looking at those sort of more longer term scenarios.
I had a comment / suggestion.
Mm-hmm.
I did want to touch on the virtual graduation. Dean Godwin, that was absolutely amazing. Like, everything was just perfect. And like I said in the chat, I'm pretty sure I cried about 8 times. So I just wanted to let you know that it was really great. But my high school that I went to, Sandia Prep, reached out to all of its alumni this year. And they thought it might be a good idea for the other alumni to write letters to the graduating class, kind of like in solidarity and giving them hope and encouragement. And I wonder if we could maybe do something for the 2020 Pharm graduates of the alumni to also do the same thing in solidarity. I don't know if we could get it together, considering they graduate officially in less than a week. But when I was writing the letter, it really did kind of put everything into perspective about, coming together and being supportive and, trying to be a mentor. And, it was really inspiring for me to do that process. So I don't know if we can maybe do something like that for these grads or for the future grads.
Well, I will think about that and we'll figure out something.
Let me know if you want me to write one, because I will.
Okay.
Yeah, Dean Godwin and Markella, I think everyone would join me on this call. You have quite a support group of alumni here with you tonight. And we thank you for all of your efforts. And again, Rebecca, I would definitely second what you just said. Dean Godwin, I know I can't imagine the pressures that you have been feeling, that everyone on this call has been feeling associated with this. And I think all of us from the bottom of our heart has tried to find any way that we could help, any way that we could offer assistance. And just know that we're here for you guys if you need us. That's why we're on this call with you tonight. So anything that we can help to support our current students, to support you, please let us know.
Okay, absolutely.
I do have a quick question, Dean Godwin. I know several universities have transitioned to MOOCs or massive online college courses. In fact, some schools out there are still also having College of Pharmacy done completely online. Do you see UNM ever transitioning to more of a MOOC-based deal with like a third party like Coursera or something like that?
No, absolutely not. I mean, I think we may go with more online delivery of our, of some of our courses, whether that's, synchronous when everybody is, all tuned in at the same time, or if we're doing more asynchronous. I think that's just a natural evolution of education. But, we're never going to go away. I mean, obviously the skills labs, are always going to be face-to-face. And the way we designed our curriculum and the way we think, with our teaching our students problem-solving skills and working through the cases, we'll always be face-to-face. But again, what happens, but where we might be changing is, a lot of the lecture material, a lot of the content, maybe the students are learning that, on their own time, and then, and then when they're coming into, when they are coming into the classroom, it is all about, it is all about active learning. So I think we could definitely see an evolution over the years for that, but definitely nothing like with Coursera or Coursera or anything like that. This plus, you know, the way we practice pharmacy in this state, you know, again, it's unique, and you know, I think we have a unique education, a unique curriculum for a unique state pharmacy practice. So. No, I would say again, we may have a little more online, but we'll always have that face-to-face piece. And the Eagles are still going to take the NFC East this year.
Time will tell, my friend.
Okay.
Hey, Dean Godwin, it's Rose. It's
Rose.
really nice to see everyone. And I just want to say that you are doing an awesome job, and you've always done an awesome job. And I'm happy to see that you're still there in the right position. I don't know if anyone else could be doing what you're doing for the students right now. So thank you for all that you're doing. I just wanted to share from my personal experience. I remember when we were in class and we were able to rewatch some of the lectures, and I actually really enjoyed that personally, because you can listen to them at the pace that you want. And here at UCSF, we're reopening school for small class learning. And I'm happy to share with you what we're doing here, and always open to collaborating and talking through some ideas based on our success or non-success here at UCSF.
All right. Yeah, you know, I get your dean's updates.
Oh, good.
I always make sure, you know, us deans, man, we send everybody, you know, all our little brag things or update things. So, you know, but UCSF, those are always pretty well written.
Yeah, we just had a strategy meeting and have decided to open up small group skills courses in a couple of months here. So, but everything.
Yeah, I'd love to hear what you guys are doing there. I think the more, again, particularly considering, I mean, obviously we're the only college of pharmacy in the state, so you know, nobody else talks about, you know, how pharmacy education should be in the state. So, you know, if I could hear what you guys are doing in San Francisco, I mean, you guys have had a harder lockdown than you know, I mean, well, the city of San Francisco has had a harder lockdown than even New Mexico has. So,
yeah, it's been quite interesting, to say the least. But you're doing a wonderful job, so thank you.
I appreciate it, Rose. You know, and I do appreciate, again, you guys, you know, taking the time and all the support that you've given me over the years, and of course the college. You know, like I said, I always want to be the dean of this place. You know, as I grew up, you know, in this College of Pharmacy, I've known a lot of you guys for a lot of years. I taught a lot of you guys, you know, while I've been here, and you know, like I said, I wanted to be dean. I was lucky enough to be chosen. I've always gotten the continued support from you, and I never, you know, who knew? Of course, nobody could predict. Oh yeah, you know, my second year of deanhood, I'll be in the middle of a pandemic. But you know, yes, you take all the challenges and you know, when you make, so somebody told me, like, you know, when life gives you lemons, you make lemonade. I've actually changed that recently to, if life gives you limes, you just do tequila shots.
Amen.
But only on the weekends.
I want to chime in and say, I know many of you have supported the Dean's Emergency Fund that was sent out about a week ago. And, you know, on behalf of the college, I want to say thank you so much, because those emergency funds are really helping our students and faculty. Don, I don't know if you want to extend on that.
Yeah, I mean, like I said, you know, we sent this out last week. We've already raised about $7,500. You know, and again, you know, when the students, you know, are, you know, this struggle is going to continue. You know, we're not, you know, this country, this state, the city is not out of the woods yet. I don't think we're even close, unfortunately. So I think, you know, we will, you know, the students will continue to struggle. The staff, I mean, hopefully we can, you know, we can safely start opening up New Mexico for business again, and Texas, Utah, California. That's everybody that I can see that are living in other states right now. But again, but to do it safely. We don't want another wave of this virus. So again, people can get back to work. We can get back to school. We can really do what we need to do, really as a country, and take care of our people, take care of our families. But again, I appreciate it if you did donate to our fund. Again, from the bottom of my heart, I appreciate it. If you have not had a chance to and want to, feel free. But if you're in a position where you can right now, it's totally understandable as well. But I want to make sure that if a student comes with a need, we can help provide for that need. Because again, we don't want anyone having to lose their education because of this virus and this pandemic. So again, I truly appreciate everything that you guys have done and will continue to do over the years. That's really all I had to say. This will not be the last of these. When there's enough information to reach out again. Hopefully in another hopefully in another month or so. We'll know a lot better. Where we are as a state, where we are as a country, where we are as a university about reopening. And I'll do another one of these. And I can't wait for the time when we don't have to do this. I don't have to do this from my house, but we can do this from from APHA, from ASHP, from our in-town here in Albuquerque events, or if I drive around the state, I'd love to get back up to Farmington and have dinner with Buff again. So like we did earlier this year. I definitely want to get out to Texas, and see the Paytons. I haven't. I want to see your backyard, because I hear I've seen pictures, and of course, Bill, you were such a great such a great host when Markella and I came out to Utah. Really appreciate it. So I'm trying to see who else is here. Oh, okay, James Parker. I see he's tuned in. Stephen Oder. Again, I enjoyed going to Texas and out to Maryland, and just to be able to see everybody who took time to join in. I really appreciate it. And again, does anybody else have any comments, questions? I'm more than willing to answer anything that you can ask, or at least give it a shot.
You still taking your Clorox for the virus?
Yeah, I've got my infusion set up in the back.
I'm pretty sure they've started making chewable Clorox tablets. I saw that on Facebook. I got stock in that company.
Actually, I do it out. I do it every morning on the east side of my house, so I get the sun as well. So.
Oh my goodness.
All right, guys. Well, again, I appreciate it. I know some of you guys are in different time zones, and it's even a little bit later than 8:09 that it is here in the Mountain Time Zone. Again, anytime you guys want to reach out to me, I've been really bad about remembering to call in to check my messages on my phone at my office, because again, I go there like once a week maybe. But you guys can send me an email anytime. And if you guys need anything from me or the college, you reach out anytime, because this is a family, and 75 years we've been around, and it's gonna be a great another 75 years. Who knew that it's like our 75th year pandemic. But like I said, we will improvise and we will overcome. That's how I live my life.
We're all just a phone call away, and as much as you guys are here for the college, we're here for you too. And the Pavlakos family is full of toilet paper, so if you need it, let us know.
And I got all the hand sanitizer, so we make a good team.
Oh, that'll work. I got the swabs.
Okay. All right, everybody. Everybody have a great night.
Go class of 2014.
There
Represent.
you go.
Woo!
Woo!
All right.
Bye, everyone.
Everyone, stay
Bye.
safe. Stay healthy.
Thank you again, guys. Close.
Bye.
All right. Bye-bye.
Vaya con Dios.
Bye.
Bye.